So a very good evening everyone. How are you? I hope I am audible and visible. A very good evening everyone. Let me know in the chat box if I am audible and visible to you. Good evening everyone, and I hope the exam is now over. So a bit of relaxation for all of you. You worked really hard for this exam. So I hope, so again first of all, I would tell you to please relax. Now the exam is done. You've worked really hard for this exam and now that exam is over. So it's time to, unwind yourself and unwind from all the pressure, all the stress you had, when we were preparing. Now this session again, which we are having now, again first disclaimer is that again we are trying to just recollect the questions. Again this is the, the same day the exam has occurred, so I'm sure you can now recollect with the best possible recollection which we can have for the questions. So let's try to understand what kind of questions were asked, and also when we are discussing, so that again the future aspirants, your juniors and others who will be giving, so that will be beneficial for them as well. So let us first analyze. Let's try to analyze from what the first recall we have got. So around 5 to 6 questions we have got till now from psychiatry. Around 5 to 6 questions we have, and again as usual one question has been asked from the basics, and one question on dementia again has been asked, but it seems more like a question from pathology. Then substance use, again we got one question. We'll again try to understand what was the question. We'll try to get that question. And in psychopharmacology again we had some questions from psychopharmacology as well, and let's try to recollect those questions as well. And one question has been asked from neurotic disorder. So let's begin our discussion. So the question number 1 is, so this is the first question. So look at this question and let me know if this is the question which was there in your exam. The question is basically that a patient believes that his feelings and thoughts, they are being interfered or they are controlled or influenced by an external agency. Please have a look at this question and let me know if this is the question which was there in the exam. So let me know in the chat box, was this the question and were these the options? So the options are, one is there is delusion of nihilism, another is delusion of reference. Option C, some students said that there is thought insertion was given, and some students said that it was basically delusion of influence was given, and D is Othello syndrome. Was there any option related with the passivity mentioned in the question? Just have a look at this question and let me know, was this the question exact wordings or were there any difference in the question? So let me know, were these the options and the question, are there any changes which you can find? So again if you see now in the question, if this is the question, now it is not a delusion of nihilism. We know delusion of nihilism, patient neglects, patient denies the existence of himself, of his body, of his family members and the world around. So it is not okay. So yes, Utsav is saying yes. Hello, yes. So the answer is, so tell me, was thought insertion mentioned in the option? Tell me, was thought insertion, because if that is mentioned, that becomes a very clear answer. We know it is not Othello syndrome. It is not Othello syndrome. So basically they are asking something related with delusion. So they are asking something related with delusion. So tell me, was thought insertion mentioned in the option? If thought insertion was mentioned, then it becomes the right answer. It becomes the right answer. And if it was not mentioned, then again we know delusion of reference is when the patient believes that things around are occurring in reference to him. That means that people are talking about him or spying on him again. So that is also an incorrect statement. So if thought insertion is mentioned, yes. So PA is saying no, no to that thought insertion was not given in the option. Tell me, was it given, yes or no? Or was there anything related with the term passivity was mentioned? Anything related with passivity was mentioned? Can you tell me? So if insertion was not given, then delusion of influence seems to be a better answer. Yes. So Abhishek says yes, delusion of influence was given. Yes. So delusion of influence in fact is a type of delusion of persecution. It comes under delusion of persecution, where in the person believes that people, external agencies, these may be influencing. So it is delusion of influence. So if insertion is not given, passivity is not given, such wordings are not given, then the right answer is delusion of influence. I hope this is clear to everyone. This is the first question. Now let's come to the second question. Again, an interesting question. A patient admitted in the hospital for thinking that he has myocardial infarction, but he was all well. So he thought that he has myocardial infection, he was admitted, but he's all well. On discharging, he is denying to go home. He is denying to go home, as 10 days back thieves came to his home, and some said that there was also mention of gun was shown to him. So tell me first, is this the question? Is this the question? And the options were acute stress disorder, schizophrenia, avoidant personality disorder, delirium. So please have a look at this question and let me know, was this the question? So again, let's try to understand what all things they have mentioned. Yes, so yes, this is the question. He was robbed at gunpoint. Okay, so yes, gunpoint was mentioned, and so there is a stressor which they have mentioned. There is a stressor which they have mentioned. Very good. So they have mentioned a stressor, and subsequently again the duration has also been mentioned. So if you see, they mentioned these things, and now what he's trying to do, family members are saying that he was okay before it. Okay, so family members are saying that he was okay before this. So everything has happened, it seems, because of the stressor. Now if you see, if you recollect, again, we have discussed this point in trauma and stressor related disorder. So there is a stressor and there is a significant stressor. He was shown a gun. So it's a major stressor which he has experienced, and it is also less than 1 month. So can you tell me, if it is less than 1 month, what diagnosis or what disorder should come to your mind? Yes, so it is, yes. So remember, we have discussed, in fact we have discussed this multiple times when we talked about, even in the LRR video also we talked about that PTSD if it is more than 1 month, and acute stress disorder if it is less than 1 month. And can you tell me what symptom? So we have also discussed this with the mnemonic of Mahi. Can you tell me which symptom you are seeing? So he is avoiding going to home where he has faced that stressor. So what he is doing, he is avoiding. So what symptom we are seeing here? There is avoidance. Is this making sense? I hope this is clear to everyone. Let me know if there is any change in the wording or in the options. Now, of course, we know it is not schizophrenia. It is not schizophrenia, and it is not, of course, delirium. There is no, impairment of consciousness, cognitive impairment, no such symptoms of schizophrenia as well. Now, they have also, they always do this, what they have done, just, to make, some confusion. They have added this avoidant personality disorder. You have seen that there is avoidance symptom, and they've added this. Again, we know personality disorder would not start like this. We know personality disorder would occur for, a long duration. It's a long standing symptom, usually have an onset, in late adolescent, early adulthood. While here, as you are saying that family member said that before the incident he was all right. So that means the right answer in this case is acute stress disorder. Acute stress disorder. Okay, yes, so you're saying rather than MI, he was having palpitations. Okay, there were some anxiety symptoms, palpitation were there. Okay, and he was okay before that, right? So I hope this is clear to everyone. The answer here is acute stress disorder. So most likely this is the question, the answer would be acute stress disorder. I hope this is clear to everyone. So the answer is acute stress disorder, right? Now let's come to the next question. Let's come to the next question now. Now I'll show you two questions. First of all, let me know that were there two different questions or they were the same question. So I'll show you the first question which we have got is that atypical, or it was simply antipsychotic with least metabolic side effect. Antipsychotic with least metabolic side effect. This is one question we have got, and this is one question we have got, that in the question there was that patient with a mood disorder, mania, depression is obese. So he is obese, and which drug again the question was, let me just reframe this question again which we have got, that which drug again has least metabolic side effect, and again antipsychotics were given. Tell me, were there two different questions or they were the same question? Were there such two different questions that they were asking which drug has less metabolic side effect or weight gain was there? Tell me, were these two separate questions or were these same questions? So one of the questions, if we look at this question, antipsychotic with the least metabolic side effect or it was weight gain. Tell me. Yes, it was like this only. So there were no two separate questions. They had given a situation of a patient having mood disorder, depression and mania was given, and they had asked that person is obese, which drug has less. They were separate. Okay, they were separate. So tell me first, what were the options? So tell me, these are the options which I have got. Tell me, haloperidol, risperidone, ziprasidone, quetiapine, chlorpromazine. So tell me, were these the options? Tell me in one question, were these the option? Now, so since we are talking about weight gain, first of all we know, antipsychotic such as clozapine, olanzapine, these are the drugs which increases, some of the drugs which increases weight gain, so these are drugs which have high risk of weight gain. So first of all, this should be clear to everyone, right? Now tell me, all these options, haloperidol was not given. Okay, haloperidol, let's remove haloperidol. You are saying haloperidol was not given. Rest all the options, are they correct? Tell me, are these options correct? Risperidone, ziprasidone, quetiapine, chlorpromazine. So they have given atypical, and they have given typical antipsychotics. Okay, were these the four options? Okay. Now again, this again appears to be a tricky question. Now when we talk about weight gain, we know drugs with the high risk of weight gain antipsychotic, that is clozapine and olanzapine. That was not in the option. Now then we have drugs which have moderate risk of weight gain, and we have drugs which have less or low risk of weight gain. Now usually we know that first generation have less weight gain, while second generations have usually have a higher weight gain metabolic side effect, and from that it seems that chlorpromazine is the right answer. But again, if we look at one of the tables mentioned in one of the books, Morge's prescribing books, we see that moderate risk has been mentioned with risperidone, with quetiapine. Quetiapine is again one drug which increases weight, clinically also we observe, and even chlorpromazine has been mentioned as a drug which has a moderate risk of weight gain, while low risk has been mentioned with drugs such as ziprasidone. Even drug aripiprazole, if aripiprazole is mentioned, that also becomes a good drug because it also has less weight gain, and in fact this is one drug we use to treat if a person has a drug induced weight gain, but aripiprazole again is not mentioned. So out of the drug, the answer will be ziprasidone. It seems the answer will be ziprasidone. But again, if there are any changes, we are trying to just recollect the questions. If there are any changes, I'll let you know. I hope this question is clear to everyone. These were the options. Now, can you tell me any options for this question? If it's a separate question, can you recollect the options? What we have got, mixed reviews that there was only one question. But if anybody can tell me, was there any different question? Was there any other question? Please let me know if there was any other question. Anyone? Okay. So we'll come to this again. Now, let's come to this next question. Again, this question was also mentioned by some of the students that there was a sudden spasm of muscle. Some said that patient has acute dystonia. Tell me, was there any such question asked in the exam? Was there any question where they had asked treatment of acute dystonia? Patient is on antipsychotic and patient has developed sudden spasm of muscle. So can you tell me what were the options? Anybody? First of all, tell me, was this question present or not? Yes or no? Did you see any such question in the exam? That is treatment of, okay, there was torticollis, right? So there is, okay, so acute dystonia, okay, torticollis was mentioned. Okay, yes. So what were the options? Can you tell me? So we know, so we have again discussed this, that acute dystonia, again we have talked about this. So we give anticholinergic drugs, preferably parentally we give, sudden onset, it is EPS which occurs suddenly. So can you tell me, so were there, which drugs were mentioned, if you can tell me? Okay, so IV benztropine was mentioned. Okay. Okay. We use anticholinergic drug for the treatment of acute dystonia. Okay. Now, next question which we have got, again, we have got this question. Can you tell me, so this question is related with substance. So patient consuming a substance and he see red color when he hear radio. So please first tell me, was this mentioned in the question? So he's seeing something. So there is some visual modality, some hallucination it seems is occurring whenever he hear the radio. So there is a real object which is auditory, and it is leading to a hallucination which is visual. First of all tell me, very good. First of all tell me, what is this phenomena? Can you tell me? Very good. This phenomena is reflex hallucination. Very good. This phenomena is reflex hallucination. So hallucination basically is occurring. It's a special hallucination which occurs when a real object, it produces a hallucination in different modality. So he is hearing something that is a real object and then he is seeing something. So that means it's a different modality, it is reflex. Can you tell me if it is the same modality? For example, suppose he is hearing the radio and suddenly when he hears the radio, he gets auditory hallucination. So voice of a man talking. So he experiences, then what is that known as? Yes, that is correct. Raki, yes. Yes. No thought insertion, we have done that. No thought insertion, the answer in that question was delusion of influence. Yes, so we have talked about, yes, if that is not given, then delusion of insertion would be a better answer. Yes. So what is this? This is so hallucinogens usually we see, especially LSD, may be associated with reflex hallucination. Okay. Anything mentioned about heart rate? Can you tell me? Yes, delusion of influence, Dr. JD was given. Yes, and we will mark that. So we'll talk about that question again. I'll show you just briefly. You can tell me again when I'll show you in the end what were the questions. So we can again just have a recap of the questions. So right, yes, heart rate was given. What was the heart rate? Increase, decrease? Heart rate increase, okay, it can cause mild tachycardia. Heart rate was increased, so again LSD, yes, that can cause. And even flashback phenomena may also be associated. Right, so the answer was LSD. I hope this is clear to everyone. Now coming to one question was there on Lewy body dementia, but I think that was more related with, again finally they have again asked question on Lewy body dementia, a topic, yes, that it's a, yes, and anticholinergic, yes, we can use, Dr. Raki, yes, so we can use. If you can tell me what were the other options also as well. So we have that one option, yes, benzotropin, yes, that can be used. So can you first tell me what was the question? So we have a question again on Lewy body dementia. We have been discussing that they are asking again question on Lewy body dementia. Last time they asked question that was Capgras syndrome was associated with which dementia. So can you tell me if you can recollect? It was more a patho question, I feel, but again if you can recollect the question, please let me know. What was the question? I think it was a history was given. And an image also was shown. So if you can recollect the question, let me know. Now also there was one forensic question also was there. Tell me if this question was there, was given along with resting tremors. Okay, so there was resting tremors. I'm just recollecting the question. It may be again solved in the patho session, but I'm just trying to recollect so that we have an idea. As much as possible we can recollect. Lewy body dementia again is very important topic, and they're asking somewhere or the other, they're trying to integrate question. And a history of Parkinson was given. Okay, history of Parkinson was given. Again we know in Lewy body dementia there are three features: fluctuating cognition, visual hallucination, and there are motor features of Parkinsonism. So they've given a clinical history related with Parkinsonism and then showed an image. Okay, they'd given. And what were the options? What were they trying to ask? Have they mentioned in the option Lewy body dementia? In the options, was Lewy body dementia mentioned? In the option? Okay, image was of Lewy body. We know in Parkinson disease we can have Lewy bodies that can be seen. Again, in fact, last year this question was asked in NEET PG exam, where they had given a clinical picture of Lewy body dementia, In the question they had mentioned Lewy body dementia, patient had Lewy bodies, and in the option, one of the option was Parkinson, and Lewy body dementia was not there in the option. I think this time they have asked a similar question, but now they have given an image. Is this making sense? I hope this is the question. So it appears that they have given a history of Parkinson, and they had mentioned in the question, and they shown an image. Yes. Yeah. So they had mentioned and they shown the image, and in the option, can you tell me Parkinson disease was there or Lewy body dementia was there in the options, or both were there? So let's try to just, so again, you know, it's a question which was similarly asked question in NEET PG with an image. Okay, so if only Parkinson disease was mentioned, so the answer is Parkinson disease. Okay, now tell me one forensic question again. Let me just discuss one forensic question as well. So tell me, was such question mentioned that a patient is mentally ill or mentally unstable, came for MTP, and consent will be taken from? Consent will be taken from again. So it's again a forensic medicine question. Again, I'm just, you know, recollecting here. Again, maybe the answer will get also in the forensic session. So can you tell me legal guardian was given? Okay, so first of tell me the patient was the patient adult? It seems the patient was given adult. Adult was given. So one, you are saying legal guardian. Legal guardian. And what was the fourth option? What was the fourth option? Option number D, what was it? So I'm just trying to recollect question here. We'll again, you know, I'll again reframe these questions and give you the answer. So can you tell me her partner? Okay, partner is there. Yes, option A. Yes, Dr. Aki, it has been mentioned. Partner is given, doctor, legal guardian. Any other option? So I'll just, you know, talk about one concept that is, you know, in Mental Health Care Act MHCA 2017. You know, nominated representative, that if the person is not in the capacity to take decision, then he or she can nominate a person who will take the decision, nominated representative. So here again, nominated representative was not mentioned. So if nominated representative is not there, the second one is we go is with relative. This is for adults. This is for adults. For a minor, the legal guardian will take such decision, but again it seems the question was of adult, so then relative will be the second option. So if relative is willing to, you know, take that responsibility, then we'll go with the relative. Okay, again there is a list, and you know, subsequently if relative is not available or it's not willing, then we can, you know, the caregiver can take that responsibility, and subsequently further, you know, list has been mentioned. So I'm just giving you a, you know, quick review of what the Mental Health Care Act says related to this. It seems that they've asked question related to that, but again we'll get more clarification when we'll, you know, you can see in the forensic session. So again, one question related, it seems related to MHCA was asked, because the patient is mentally ill, so again MHCA comes into picture. Age of the patient is not mentioned, and married history also not there, but again they have mentioned the partner, so it seems that the person is married. So it seems like an case of an adult, but again not very sure. We have to wait for the all the options. So again, these were some questions. I'll again just recapitulate again. Let's just see what are the questions. Some questions I think we are able to get. So this is the first question. I'll just go through the question again. You can just, again, those of you who have joined, you can just let me know. The question is, a patient believes his feelings or thoughts are controlled or influenced by an external agency. So so what they've asked, again you're mentioning that thought insertion or passivity, such phenomena is not given, so we have to choose from these option. Okay, it was not mentioned adult or not, so I got it. Yes, great. So it seems the answer here is delusion of influence. I hope this question is clear to everyone. So here the better answer will be delusion of influence. Okay, then next is, again this question I think is clear to everyone. Most likely this is the question that a patient was, you know, there was a thief at home 10 days back, and since then he is admitted in the hospital and is denying to go home. He is avoiding after a stressor, a significant stressor. So the answer here is acute stress disorder. We have talked about this, less than 1 month acute stress disorder, more than 1 month we've talked about PTSD. Okay, PTSD. Now I hope this is clear. Now this question again, slightly tricky. Again, we'll come back to this question, but again, if this is the question, haloperidol is not mentioned as you are saying, we have to choose a drug with less weight gain. Less weight gain, as you're saying, is mentioned. So again, out of these, if we see Maudsley, again it mentions risperidone, quetiapine, chlorpromazine as drug with the moderate risk. So low risk is ziprasidone. Again, for for others who are preparing for various exams, remember aripiprazole is one of the drugs which has less weight gain and sometimes even used in patients who have antipsychotic induced weight gain. Okay, so it seems the answer is ziprasidone here. Is it clear to everyone? Now, then there is a question of acute dystonia. Acute dystonia, again, so we know we use anticholinergic drugs, parenteral drugs. Can you recollect the options? Can anybody tell me the options if you can, or maybe in the message you can let me know. Any question, any new options which you remember were there, or any reframing of the question, you can just let me know in the chat box below this video. I'll answer there as well. Okay. Now, next is this question again. This question, patient was, I'll come to that question. So this question again, this question I think is clear to everyone, that a person is having hallucination in a visual modality after he is hearing things from the radio. So this is reflex hallucination, also known as morbid synesthesia. Morbid synesthesia. Okay, this is again an old question of AIIMS, morbid synesthesia or reflex hallucination associated with hallucinogens such as LSD. Okay, so the answer here is LSD. I hope this is clear now. So in this question, what was asked? Diagnosis was asked, or were they asking you to identify the image? Can you tell me? So again, it seems more of a patho question, but again, I'm just trying to recollect the question because again, important. Lewy body dementia is a very important topic. So you have saying that history of Parkinsonism was given and image of Lewy bodies was given. So did they ask you to identify the image, or did they ask you to identify the diagnosis? Can anybody again just clarify this? Can you clarify, please? Identify the image. Okay, so this again this will go to patho side again. I think pathology ma'am will discuss this in detail. So this was the question. Roughly this was the question. Image was given, history of Parkinson was given, and you had to identify the image, right? Okay. So, and one question on forensic, again I've just told you one important point related with this. So again, the question was that a patient who is mentally unstable comes for MTP. Again, you're saying that it was not mentioned that what was her age, but in the option it was given that partner. It seems they were asking related with an adult and came for MTP. And just one concept you should remember in nominated representative, that means if the person is not in the capacity because of mental illness to take a treatment related decision, then we have a hierarchy. One is if the person has made advance directive and has nominated someone, that will take the decision, but no such thing has been mentioned. So the second is, then we look for relative. So relative here is the partner, so related by blood or by marriage. So here then answer will come out to be partner. Then we have list, then will be the caregiver, and then otherwise if caregiver is not present, then review board will appoint someone. So they have given a hierarchy. So here it seems the answer is relative, but again you can clarify this. Okay, age was not mentioned. Again, it appears for minors the person who will take decision is the legal guardian. So they have given this legal guardian. So again some confusion has been created. Okay, some confusion has been created again. So you can discuss this in the forensic session as well. I'm just trying to recollect the question so that we have an idea, and you should just know this hierarchy as well. I hope this is clear. So these were the questions which we got. Can anybody tell me, were there any other questions? Any other questions related? This up till now I'm not sure whether this was a separate question or not. So if anybody can tell me, did they ask something related with mood disorder also with less weight gain? In mood disorder also, did they ask any drug with less weight gain? Adult was given. Okay, Anshul is saying adult was given. So again, I hope you have got the crux of that question. So these were some questions which we have talked about. So again, please remember, the exam is over. Don't worry. Now relax, enjoy this time, and do things which you have missed doing because of the preparation. Okay, and you know, all the very best for the result, and thank you very much. Anything which you remember, or you know, any options you recollect, just mention below this video, and I'll be you know, watching the space, and you can just mention. Okay, patient with mania and depression, drug of choice. So again, if you can tell me, generally again we know, if the patient comes to you in manic phase, we have 3 first line drugs: antipsychotics, lithium valproate, and for depression we have antidepressant, and in bipolar disorder we, along with antidepressant, may also add a mood stabilizer. Okay, so I hope this is clear to everyone. Thank you everyone, and again, don't worry, the exam is done. Again, this is just a recollection. Some you know, answer may change depending on what was the exact question, so don't worry, and just relax and enjoy these days. Okay, thank you everyone.